Kia ora koutou. My name is Steph and today I'll be discussing the mental health crisis that we face in New Zealand, especially for teenagers, and why there should be more funding for mental health services in schools. Youth mental health is a huge problem area in Aotearoa, New Zealand. 1 in 5 people experience mental illness or significant mental distress, and for many people these struggles can begin during their childhood or teenage years. These statistics are much worse for certain groups of people. Māori, Pacifica, low socioeconomic communities, and those who identify as queer or transgender are much more likely to experience mental health issues or have worse outcomes as a result of these issues. He Ara Oranga, or the Government Inquiry into Mental Health and Addiction, identified key failings of our health system to respond to the current and growing mental health needs. One of their key findings was that the mental health of children and young people has been getting significantly worse over the past decade, with over 23% of teenagers experiencing symptoms of depression. This figure jumps to nearly 38% for Māori and Pacific teenagers. So it is clear that something needs to be done to fix this issue. But what can be done? Mental health is an incredibly complex topic, and it cannot be fixed with a simple pill or a one-size-fits-all approach. Psychological therapy is one form of treatment which is shown to be effective at supporting those going through periods of mental distress or mental illness, but it doesn't come cheap. Private psychologist appointments start at roughly $150 per session, and many people will require several sessions or long-term support. Considering poverty and deprivation are some of the key risk factors for mental illness, financial barriers are a huge issue. Publicly funded therapy services are available in New Zealand, but even for severely distressed people, the wait times can be significant due to over-demand. This means that psychological support is unfortunately not an option for everyone who needs it when they need it. For many young adults, this can cause long-term, unresolved mental health issues throughout adulthood, or worsening symptoms such as self-harm or even suicide. For some cases, extended wait times and financial barriers to access mental health services can be the difference which pushes someone over the edge. Our suicide rate has been described as a national shame, and it's clear that more work needs to be done to reduce this. Recent budget announcements, such as the Wellbeing Budget 2019, have increased investment into mental health services in an effort to tackle this issue. The funding will go towards increasing the range and capacity of the services available, especially for high-risk and vulnerable individuals. But I believe more needs to be done, especially for teenagers in New Zealand. The government inquiry noted a lack of awareness, education and support in primary and secondary schools regarding mental health. School counsellors and psychologists have expressed they are constantly overwhelmed and more services are desperately needed in schools. Increasing the number of clinically trained counsellors in high schools in order to meet the demand would greatly improve access to necessary services. No student should be turned away from mental health services or told they'll have to wait several weeks if they feel that they need them. If more clinically trained counsellors were implemented in high schools, then students would be able to access regular therapy services in order to cope with periods of mental distress or illness, and those with higher needs could be referred to more high-level services. High school is also an appropriate avenue to offer mental health services, as it reduces accessibility barriers such as transport, getting time off school, and organising appointments with external providers. For poor students, Māori and Pacifica students, and students in rural areas, removing these barriers will be essential in helping them get the support that they need. From a population point of view, offering fully funded counselling services as needed will support our youth and reduce the impact of mental illnesses and mental distress in the community. Removing the financial and logistical barriers to accessing these services would dramatically improve outcomes for patients with mental health issues, and it would also reduce the burden on hospitals and emergency services. This would be an expensive investment, but it is one which is necessary if we want to support New Zealanders to live healthy and happy lives and to reduce our suicide rate. Thank you for your time.